Hi, everyone. Thank you so much for joining us for this webinar that we are going to discuss complicated emotions and traumatic parent experiences with Dr. Monheim James. Thank you so much for being with us tonight.
Thanks, Erica. Thanks for letting me be here and talk about this really important but not very well understood experience.
Absolutely. And I am Erica Klauber. I'm the Executive Director of Children's Craniofacial Association. And we are pleased that this is a part of our virtual programs that we started back in 2020 that we've kept going, and we have dedicated to offering one virtual program a month. And this will be available on YouTube and our other channels. So before we get started, I always like to read our disclaimer just so everyone is on the same page. Please know that this session is for informational and educational purposes. It's not intended to diagnose or treat any illness or condition. No one here from CCA or on the call can offer specific or individualized medical advice, but we do share from our own personal and professional experience. For your own medical advice and professional help, we suggest you contact your personal doctor or your craniofacial team. Please understand that the views, thoughts, opinions expressed in this program belong solely to the speakers and not necessarily to Children's Craniofacial Association, the speaker's schools, employers, organizations, committees, or other groups or individuals. So now that that is out of the way, it is my great pleasure to formally introduce Dr. Cynthia Monheim James, who is a clinical psychologist in the Cleft and Craniofacial program. Dr. Monheim James' expertise includes helping children and their families navigate medical treatments, surgeries, and other challenges associated with complex chronic health conditions, including craniofacial and neurological disorders. She is trained in psychosocial, neuropsychological, and pre-surgical evaluations, as well as medical psychotherapy and medical team consultations. She is a member of the American Psychological Society Association and the Society of Pediatric Psychology. Dr. Monheim James earned her master's and doctorate degree in clinical psychology from the University of Arizona. She completed an internship in neuropsychology at the University of Arizona and a fellowship in pediatric psychology at Children's Rehabilitative Services at St. Joseph's Hospital and Medical Center. So with that, I will turn it over to you.
Thank you, Erica. We hear a lot about traumatic stress in children going through multiple medical procedures, and we're trained to look for that and help children. What we don't spend enough time on, in my opinion, is understanding and addressing the traumatic experiences parents go through as they navigate the healthcare system with their child. So that's our topic tonight. What is a traumatic experience for a parent? How can we understand that a little bit better? And how do we move forward and take back control over those experiences that maybe at one time feel very overwhelming? Okay. Becoming a parent and going through the process of pregnancy, delivery, and caring, meeting your new child, caring for your child, it's so many complicated feelings. The joy of parenting is so strong. The excitement of parenting is so strong, but there are also many other feelings that can come up, especially if the process is not as you expected, or if things don't go in the way that you had hoped. So tonight we're going to talk about complicated emotions and traumatic parent experiences. All right, so here are the goals for tonight. Understanding what trauma is. Okay, a traumatic parent experience, I think, is something that we're going to be hearing a lot more about as we start to understand how trauma affects the whole family, not just the child. We're going to talk about what is a traumatic experience and compare that to PTSD or a trauma disorder. Not all traumatic experiences turn into a trauma disorder, and that's important to understand. We're going to talk about the stress points at the different stages of pregnancy, birth, and beyond. And stress points are those unexpected times where maybe we feel overwhelmed with the information we're getting or with the experience we're having. It's not what we expected. It's not what we imagined that situation to be. We're going to talk about how, as humans, we respond to trauma. Trauma is not just something that happens in our thoughts. Trauma, it has a very strong impact on our body, on our thoughts, and our emotions. And all of those can be intertwined, but it's helpful to think about them separately and talk about how they interact uniquely in each of us. We'll also talk a little bit about grief, and that's not something that most people think about when you are talking about bringing home a beautiful baby, adding someone to your family. But we'll talk about why it's important to be aware that grief can be a normal response when things don't go as we expect. We'll talk about some coping strategies for managing stress and traumatic stress. And we'll talk about some of the more formal treatment options. As we're having this conversation tonight, I encourage you to check in with yourself as we're talking about these topics. Notice if you're feeling any stress while we're talking. Notice kind of where that stress is coming from. We'll be talking about some things that may bring up your own memories or memories that people close to you have spoken about. Be mindful of what's happening in your body, in your thoughts, and in your emotions. If you need to, take a break, put us on pause, take a deep breath. And I'd like to start by just talking about a simple calming and breathing exercise. If we're starting to notice we feel stressed, and we call that a 5-finger breathing exercise. This is a great video from Children's Health Center of Orange County, and it's focused on children, but it's perfect for parents, and it's something that can be helpful for us, and we can share this skill with our children as we're guiding them through some of the stressful experiences in life. So it's a great one to try now, keep in your back pocket if you need it later as we're talking, or in the future.
My name is Dr. Sabrina Stutz, and I'm a pediatric psychologist at Chalk Children's Hospital. Today, I'm going to teach you a strategy for breathing for stress reduction called 5-finger breathing. Sometimes it can be helpful to have a visual while we're trying to breathe to calm ourselves down. So what I'm going to ask you to do is put your hand out in front of you, like you're about to give a really awesome high five, and take your pointer finger, place it on the outside of your thumb. And when we trace up a finger, we're going to inhale. And when we trace down a finger, we're going to exhale. Remember to use our belly breathing. So soften your belly, shrug your shoulders a little bit, get them loosened up, and we can begin. So we're going to inhale as we trace up and exhale as we trace down. Inhale as we trace up and exhale as we trace down. And if your mind is starting to wander, you can bring it back to the side of your hand and the feeling of your fingers as you inhale, as you move up, and exhale as you come down. Inhale up and exhale down. This can be a fun strategy for kids who are having a tough time, but it can also be a good activity to do before bedtime to keep kids calm and help them learn to breathe in a calm way so that they can use it when they're feeling stressed out later.
All right, so now that we're calm and centered, let's talk about what is a traumatic experience. National Institutes of Mental Health describes a traumatic event as something that's shocking, scary, or dangerous, an experience that can then affect someone emotionally and physically, okay? Traumatic experiences, by nature, they activate our very primal fight, flight, or freeze response. And I add to that our protect response, especially as parents. When we become parents, we kind of have a new instinct that takes over, and it's very real and very powerful. And it can get activated in situations where it doesn't seem logical that it should be activated. We'll talk about that in a little bit. Now, a traumatic parent experience. This is something that really is not an official term. We don't know a lot about how trauma impacts parents, but traumatic events involving our children are really complicated. Um, we haven't really studied how traumatic medical experiences in our children affect the families, affect the relationships, and affect the parent on a very personal and biologic level. It's a parent's instinct to protect and guard a newborn or a child. It's hardwired into us physically and emotionally. It goes beyond logic. It goes beyond our logic brain. Even though logically we understand that sometimes when our babies are born, they need immediate medical attention, they need immediate medical help, urgent medical help. Not being able to protect, hold, care for, or sometimes even see our newborn during that very urgent and scary time right around birth, that can be a traumatic parent experience. And usually, if that's happening, there's so many things going on that parents might not even be aware that they're going through a trauma, even though they're feeling very, very overwhelmed. What we also don't fully understand is that the physical and hormonal changes that happen with pregnancy and around pregnancy and after birth, those physical and hormonal changes can make us particularly vulnerable to experiencing trauma and even creating traumatic memories, okay, which can be the thing that really causes us some distress down the road. We'll talk about traumatic memories and where they fit into trauma diagnosis in a few minutes. So traumatic experiences are not the same as having a trauma disorder. It's not the same as PTSD or other trauma disorders. It's very, very normal in the days and weeks after a traumatic experience to have symptoms, have a lot of unpredictable emotions, physical symptoms, problems kind of thinking clearly. It's really common to have sadness, shock, anger, irritability, feel nervous, feel easily startled or on edge, to have problems sleeping or eating, to not feel like yourself. It's common to have some of those memories from that traumatic experience to pop back in your mind, pop back in your dreams. It's common to want to avoid the situation or avoid the things that make you maybe remember that trauma. Usually, for most of us, these symptoms will get better with time. And every day we feel a little better. Every day the trauma fades. So just experiencing a traumatic event does not mean you have PTSD or a trauma disorder, okay? But if the symptoms we're going to talk about, if they're really intense, if they persist for up to a month or more after that trauma is over, if they're getting in your way, if they're keeping you from doing the things you need to do in your life, from taking care of yourself, or they're affecting your relationships or your work, then we might need to think about that as a trauma disorder, okay? We kind of divide trauma disorders into, two different diagnoses. One we call acute stress disorder. That just means that it's a set of symptoms that are really kind of impacting us, getting in our way, and they're there for up to a month after the traumatic event. A lot of this definition, though, depends on the definition depends on the trauma being over. Okay, we'll continue to talk about that. You'll hear lots of people talk about post-traumatic stress disorder or PTSD. And really it's those same kinds of symptoms that we're talking about in acute stress disorder, but they persist longer than a month and they're getting in your way, okay? And again, we talk about these diagnoses or disorders as symptoms persisting after the trauma ends. Well, sometimes we're in situations where the trauma just isn't one isolated event, where the traumatic experiences keep coming. And so what do we do with that? It's another area where I think we're just beginning to ask the right kinds of questions and understand how multiple traumatic experiences can impact kids and families. All right. So let's talk about traumatic parent experiences. They're actually a lot more common than we think. And usually when we're talking about pregnancy, birth, and beyond, there's usually more than one. So it's not an isolated experience. If we look at all the births, nothing complicated, just typical births. And we talk to those moms about their experience. Close to half, so 45% of those moms will report that the delivery was a traumatic experience for them. It doesn't mean that they have PTSD, but it means that that was an overwhelming and traumatic experience. And that's if everything's pretty typical. And this one was surprising to me as I was preparing to talk about this topic. Out of those 45% of moms who were saying this was a traumatic experience, 2/3 of them identified interactions with providers who were there at the time of the birth as one of the things that was very traumatic. And that can be an interaction that, maybe is so brief, maybe is an interaction that happens in the heat of an urgent moment. But providers and people who are sharing that birth experience with us have a very powerful impact on our interpretation of that experience and whether or not we find that birth experience traumatic. And I think this is an area that we need to understand so much better. If we talk about typical birth experiences and we look at the data, about 4% of moms will actually meet the criteria for PTSD after a typical routine birth experience, okay? Now, if those moms have had a high-risk birth, then up to 18% of those moms go on to have a diagnosis of PTSD. If we look at parents who have had a child in the NICU, okay, after birth, in the ICU, the rate of PTSD goes up dramatically. And we see close to 40% of parents meeting the diagnostic criteria for PTSD at some point after that NICU experience, which is just very dramatic. So across pregnancy, delivery, and birth, right? We expect that to be a time of joy, excitement, celebration, sharing the news with everybody, and lots of positive planning. For a lot of us, we are planning on being parents. We have a vision of being a parent long before maybe that baby is even with us. So along with all of these dreams, hopes, excitement, and joy, we might have to face some very unexpected, frightening, and traumatizing experiences. During pregnancy and during the time around pregnancy and afterwards, our bodies and brains are doing amazing things. We are building a new human inside of us. We are creating a whole new circulatory system. We're creating new organs. We are, it's unbelievable what our bodies and our brains are doing to change and get ready for that baby, get ready for parenting, get ready for all the things that come next. But with those superpowers, we also have some vulnerabilities. Some of those same hormonal and physical changes that give us the superpowers to create a baby, to give birth, also make us more vulnerable to things like depression, anxiety, emotional distress, and the neurobiologic pathways of creating traumas. Okay, so when do we encounter traumatic experiences? Okay, what are some of the common stress points? And so I'm going to call them stress points. It doesn't mean that they're traumatic for everybody. It doesn't mean that they lead to PTSD or another stress disorder. But these are the things that commonly can be those points where we really maybe feel the floor drop out from under us in pregnancy. We usually start our pregnancies, for most of us, really expecting everything's going to go just like we see, in the commercials, just like it's going to be everything smooth and exciting and joyful. Unfortunately, as we're going through prenatal care, sometimes we get a hint that there might not be something going right, that there might be a medical concern, that there might be an issue with our baby. The reaction of the ultrasound tech, the words that they might use, the words that they might not use, can be another stress point, can be another point of a really traumatic experience for families as they're navigating some of these prenatal appointments. If you do have to wait, if your ultrasound does identify something of concern, usually there's a waiting period anywhere from a couple days to a couple weeks. And that time, some people can put it out of their head, move forward. Other people, that can be 2 weeks of hell, imagining the worst, not being able to eat, not being able to sleep, really experiencing that onset of immediate, this is a traumatic experience. Families are so in tune and so perceptive to the words, the tone of voice, the facial expression of the provider when they're getting that information. Most of us, when we get that information, we'll go home and we will actively Google. And even though we know, that might not always give us reliable information, usually we come across the most overwhelming, the most frightening, the most terrifying scenarios. And we do that usually alone. We do that in isolation. And then there's waiting and wondering and waiting, because most of us don't have certainty. Most of the ultrasounds, most of the diagnoses that parents receive have a wide range of variability. So you may be told this might be a mild presentation. You may be told that this could be a severe presentation. We will have to wait and see. Is mixed in with what can really be called grief of the loss of this kind of perfect pregnancy. Now, we know that it's a myth. Nobody has a perfect pregnancy, but it really is something that can hit us hard when we find out that there may be a medical issue with our baby, and grieving the loss of that idea. In pregnancy, one of the hardest things that families talk about is deciding how and when to share that diagnosis with close family members, close friends. Do I share that with people at work? What do I do when they ask questions? It can be a very traumatic and isolating time for lots of families. And then as families do share that information, another really difficult point to navigate, difficult time to navigate, are the questions that might come back from the other people, the people that are closest to you or the people that you're trusting. Questions, comments, advice, maybe well-meaning. Some comments that people make can even feel like blame. Well, even though logically we know that many of these medical issues, craniofacial conditions, happen for no predictable reason. That doesn't mean that we can't feel the sense of guilt or potentially feel like somebody else is saying there's something we should have done to prevent this. Okay, so all those points in pregnancy, especially with a craniofacial diagnosis, can be points of significant stress and can turn out to be points of trauma that linger. Birth and delivery, feeling out of control and unprepared. If our babies come early, we feel unprepared. If our babies come on time, a lot of times we feel unprepared. Having unexpected procedures or events happen during the birth. Maybe you have a birth plan, maybe you have a expectation of how this is going to unfold, and things can change very quickly, very urgently during delivery. Feeling not supported or alone, even if you have people there who are there to support you. If you have the sense of being in this alone, that can be another layer that adds to the feeling of trauma. Now, medical professionals do a fantastic job, but when there are urgent issues, when there are medical crises, medical providers and staff, they go into crisis mode, and they may not be able to be soft and comforting. They may not be able to give you, the reassurance if they're urgently addressing a medical issue. And that can be interpreted as a traumatic experience by many moms going through labor and delivery. Even something simple as the, outside staff, the housekeeping staff coming in and out, right? Those experiences can be absorbed, can be kind of part of our experience of the trauma. And logically, we know they don't have anything to do with it, but it can be part of what really is upsetting, what is overwhelming to us. Of course, injury or unexpected pain or extreme pain during the birth process, delivery process can add to that sense of trauma. And then having that baby whisked away to the NICU or removed from your sight, even if we know it's because there's a medical urgent need, because these doctors are taking care of my baby, but having that baby taken away is just such a traumatic and just challenging point for any parent, especially right after birth. We talked about before, there's a heightened state of arousal, alertness, and a heightened state of experience in pregnancy. That's part of the adrenaline rush. That's part of the experience that helps us get through the pregnancy. But those same factors magnify all the experiences around us. So the joy can be magnified, but the terror, the fear, the what ifs, the feeling out of control, all of those can be magnified at that time too. And that's important. It's important to remember, and it's important as we think about our own experiences giving birth. Okay. After birth, beyond, okay. We talked about this earlier. So you see unpredictable, terrifying things happening all around you every minute of the NICU sometimes. The noises, the sounds, the other grief, and sometimes you see families, not being able to return home with their child. And so that battlefield, I think, has a lot to do with what we're seeing when we see very high rates of PTSD after the NICU experience in parents. Surgical day, whenever that is for you as a parent, just a few weeks ago, years later, after their own experience, somebody in my office described that as the worst day of my life. I mean, the worst. Okay, and I believe it 100%. Seeing the baby in the recovery room or the hospital bed, even if you've been told the surgery went perfectly, couldn't have asked for a better outcome. When we see our baby, sometimes still lethargic from the anesthesia, sometimes with tubes, sometimes with swelling, sometimes with, all kinds of machines, that is a traumatic memory that can, really be burned into some families' memories and can stay with them for a long time. Taking the baby home, should be a super exciting time. We finally get out of the hospital, we get out of the NICU, we can start our life. Lots of joy, lots of excitement, but then also a very real fear. Wait a minute, we're not going to have 5 different nurses 24/7 there to support us. We're not going to have all these monitors and machines in case something, something goes wrong. I'm going to have to be the one doing these things. Can I do that? It really is a combination of joy, excitement, success, and for lots of families, very real terror and fear. And then something else we don't really talk about, the social challenges that parents face when they have a medically fragile baby. Going home from the hospital with a child with complex medical issues or a child who's just come out of surgery, you can't go and do some of the things that you would normally do if your baby didn't have a health condition. You can't go and make the rounds with family. You can't go out to the shopping center. Maybe your life is going to be structured around medical appointments, medical treatments, and really, avoiding interactions with other people just for the health of your baby. And then a big part of your life is going to be taken up with scheduling appointments, meeting new doctors, possibly getting referred to people like geneticists or other surgeons. This is the point where, after talking about these stressful things, we check in again. What's happening in our mind and body, in our emotions? What kind of memories have popped up as we've been, thinking about these things? And this would be a great place to take a pause, to take your 5-finger breath if you like that, and do some other things to calm and center yourself. But just having this discussion, having this talk right now, for many people will be another stressful event.